Welcome back to our Teach Out on Preventing Gun Violence in America. I'm Rebecca Cunningham, and I'm here today with Mark Zimmerman and Justin Heinze, and we're here to answer some of the questions that you all have put forth during our Teach Out. So Mark and Justin, these are great questions from our learners. Maybe we should start today by a question that came up several times is, how do you see gun violence as being different from other forms of violence? Why do we talk about gun violence, and why are we talking about it today differently than just talking about violence in general?
Well, it is a subset of the larger issue of violence, but not all. Guns is a mechanism of injury and morbidity and mortality, injury and death, and we're speaking about that mechanism just like we would speak about cars or swimming pools or other modes of injury. And so it's more focused on sort of that mechanism and what we can do to make them safer for people to use.
Right. So one of the ways that we think about when we think about the theories of preventing injury are thinking about the underlying mechanism of what actually causes the force. And in this case, that force is the gun. And so that's why we talk about gun violence specifically and not just violence broadly. And one of the reasons I think all of us are talking so much about gun violence right now is the lethality that particular kind of mechanism that a gun can impart causes damage and lethal damage so much more quickly than other types of violence. And so it's risen to a lot of alarm in the country as we look at the statistics that we're facing.
Absolutely, and I think it's true across context, whether we're talking about interpersonal violence or talking about self-harm like suicide. As soon as a firearm is introduced into the equation, the lethality skyrockets and the likelihood of morbidity and mortality also goes up significantly too.
Yeah.
It's kind of like Venn diagrams. It overlaps with violence, but it isn't only violence in terms of gun injury and death.
Right. You know, one of the things that I think about as an emergency physician is we mostly don't see suicide by gun in the emergency department because 95% of those attempts, those folks die in the field because it's so lethal, whereas other types of suicide attempts wind up being seen and being treated. And that's why we need to think about gun violence specifically and not just lump it in generally to other types of violence.
You know, that ties into one of the other questions about data, and how little we really know for just the reason you said. A lot of our data is emergency department data, but we have less information about suicides because they don't make it to that place. And so it's one of the limitations of our data and why it's important that we conduct more research and have more resources to answer some of those kinds of questions.
I see some of our questions have been around what we know or what we've been able to study or understand around who perpetrates violence, gun violence, and what their motives might be. And I know we don't have a lot of information on this topic across mass shootings and school shootings, for example, specifically mass shootings. But I know, Justin, you've looked a little bit in thinking about school violence and some of what happens in perpetration and why.
Yeah, it's really interesting. I mean, I think because of that lack of violence, lack of research and evidence to support these, we are in many cases relying on case studies or a limited number of pieces of information, specific school shootings, and trying to extrapolate from there. There seems to be some evidence that males are by far and away the most likely to perpetrate shootings. Middle adolescents, oftentimes they have a history of victimizations within their school, feelings of ostracism. You do see some consistent patterns in terms of well-planned attacks, organized. Oftentimes they'll communicate their intentions to harm other people, but it's not fair to say that there is a profile of, for example, a school shooter. And as much as we might appear to know about school shooters, I think when we move to older ages, the dearth of research is even more pronounced.
So it's a really good point that the root of one kind of gun-related injury and death really speaks to different factors that may be associated with those outcomes versus another mechanism. And school is one, and as you said, there's another.
Mm-hmm.
Yeah, it makes me think about some data that I saw just even this past weekend that I think, since we're doing this here at Michigan, is data on the state of Michigan, which surprises some folks to see that if we look at over time, over the past 15, 20 years in the state of Michigan, that the group that's experiencing increasing gun violence in our state are typically folks over 35, typically men, and more often white than not. And that's not the typical group that people may think are experiencing the most gun violence in their state or in their country, but that's what we see here in Michigan. It's different state by state, but that's a fairly consistent pattern nationally.
There's also the rurality and urbanicity. More of those, that profile that you just described is often more likely also in more suburban and rural areas. And it's probably mostly related to suicide, right? And not as much interpersonal violence. We had a question earlier about gangs and guns, and gun violence is way beyond just gangs. Gangs is a small subset, and yes, some gang activity will involve guns, but that's a small drop in the bucket of the number of deaths and injury that occur from guns.
Yeah, one of the other questions that comes up a lot is around the idea that firearm violence is very much related to people are looking for root causes, either video games or mental illness, and that if we addressed those issues separately from guns specifically, that we could make progress here. Do either one of you want to give thoughts on that?
I agree with you, and you do see it's a fairly consistent narrative, and I think it can be a dangerous and alienating one. There are millions of people in this country that suffer from mental illness, and yet somehow you have firearm violence and oftentimes the terms like rampage shooting, mass shooting, tied inextricably with mental illness. But having depressive symptoms, schizophrenia, bipolar disorder does not necessarily make you more likely to perpetrate violence, which I think it's important to decouple serious violence from mental illness, because many of the people who perpetrate serious violence do not show any history of mental illness prior to or following the events.
Yeah, the other narrative that we hear a fair amount about is around video games, and we have no research to demonstrate that video games directly relate to any increase at all in gun violence. And we know actually we are not unique as a nation in our love of video games, that nations across the world really enjoy video games, and yet we do seem to be unique in the amount of gun violence that we're experiencing. Specifically, we have 37 times more gun deaths among children and teens than any other industrialized nation, and 7 times more than any lower income nation. Yet we don't necessarily have any indication that we have differences in mental illness or differences in the amount of video games that are being played in any of those countries. And so we need to work together to think about other solutions here.
People have mental illness. Sometimes the shooters have a mental illness. That doesn't mean that mentally ill, therefore, is the risk factor, right? So what would be another sort of lay example of that? I think there's also the problem of people don't really understand mental illness.
Well, I think the part that is confusing for people is there is an idea that anybody who commits such heinous crimes must be crazy.
Exactly.
And in fact, hate and impulse control is not mental illness.
Exactly.
And it's not treated in the same manner.
Right. That's right.
And so that's where we have to understand what the differences are between those. The other part of this conversation around mental illness, though, and gun violence comes back to, again, that people with serious mental illness are much more likely to be victimized than they are to be perpetrators of gun violence.
I think that's a really good point.
So when we think about mental illness and we think about gun violence, we have to really think about that victimization component.
Well, and the narrative is almost always focused on violence towards others. It often gets lost again when we think about suicide and self-harm. Mental illness is a consistent risk factor.
Point.
And so that piece gets overshadowed.
Let's talk for a moment about, there's a lot of questions around mental illness and how mental illness is related to gun violence. Let's talk maybe about some of the questions that come up here around the myths and what we know about the research and the data.
Mental illness and gun violence are often conflated, especially around the mass shootings that we see and maybe around interpersonal violence where it may not be a mass shooting. And we attribute the behavior to mental illness, but suicide, gun violence, and depression may be a little bit more connected in that regard. But it's the data are still out about mental illness and a greater increase of perpetrating gun.
Yeah, so far we have no data that shows that folks with serious mental illness are more likely to be perpetrators of gun violence, of mass shootings, or of interpersonal violence than folks who do not have mental illness. And in fact, those with serious mental illness are more likely to be victimized, as you said. I think people get confused because we see these horrific acts like in Odessa last weekend, and we think that the person, how could you possibly do that unless you weren't crazy? And we conflate that common term of crazy with the diagnosis of mental illness, when in fact hate and impulse control and anger are not mental illnesses that are diagnosed or that are treated in any of the way that we think about in a medical format. It's a really common question and something we're coming up with and need to come up with answers on that are clear for the country.
Yeah, well, and I think even clarifying that piece, that the decoupling of mental health and firearms is important, particularly for youth. There are millions of youth who suffer from depression and anxiety, and when they hear a narrative that consistently links firearms with mental health, does that do anything to their psyches and how they understand themselves? Does that make them think, I might be more violent, when it's just when the data is just not there?
It's not there, and we already have a big problem with stigma and people seeking help for their mental health in general. And we don't want people to think that because they have depression or they have other mental health issues that they are necessarily more likely to go on and commit these really horrific acts. That's not what the data shows. There's a question by a learner that's really about the Second Amendment and what we know about gun violence and gun safety prevention and how that can interact with the Second Amendment. And are those two incompatible? We are very black and white in this conversation culturally, with thoughts that we either have to have it or not have it, and that has something to do with decreasing injury and death. And you guys want to talk a little bit about that?
Well, I consistently decouple the Second Amendment from gun firearm safety. They're not the same thing. We're not constitutional scholars, or at least I'm not. We are not talking about rights. We're talking about safety, and I think we need to distinguish those two things. We can do a lot better than we're doing now in terms of gun safety. We're not talking about taking away people's rights. We're not talking about changing the Constitution. I've seen data, 35 to 50% of Americans own a firearm. Many of them are hunters, and that's what they do with them. And we're not talking about taking away that right. What we're talking about is how do we figure out ways to reduce the 30,000 plus people who die every year. We're not even talking about injuries, but who die every year because of firearms. There's got to be something we can do that could be better, and we don't have to touch the Constitution. I mean, it's almost impossible to change the Constitution anyway.
But you're right. I mean, it doesn't have to be incompatible. I think you can exercise your Second Amendment rights, but then still promote firearm safety. We see it in automobiles. We see it with pool ownership. We see it with fire alarms. All things that have been introduced to individuals over time that have decreased injury, and I think we can do something similar with firearms.
Mm-hmm. I always think it's interesting in the 1960s when we decided that cars were killing way too many people on the road. No one suggested that the answer to that was for us to get rid of cars. The answer to that was for us to do really good injury prevention, safety work, and to work with the fact that we all want to drive a car and be safer. And we are safer today than we were before.
Go ahead.
No, and I think there are some innovative ways to improve firearm safety that are becoming more and more common. I don't know if people know about them. I mean, but through our work, we've spoken to firearm owners about things like child protections, about home safes, about biometric locks. As this becomes more mainstream, it might feel more like the safety belt that we use every time we get into a car.
Right. There's a culture change around the safety part, and I think it's important that for many gun owners that we talk to, biometrics will never be the right answer for them. That we have to really work to see which solutions for safety will work for individuals. It was suggested recently many guns are stolen out of cars, and many guns are unsecured in cars because people want them handy for their protection, but then they're also handy for their toddlers and their teens. And an innovative solution that was brought up to me recently is, perhaps we could have cars that included a gun safe in them, a place to lock your gun. Well, what an interesting idea. That would probably increase the safety and still allow the gun owner themselves to have access to it reasonably quickly, but know that their toddler couldn't get into it while they were in the car. There's so many ways that we could be safer here, and different ones will work for different families, and we'll have to work together on that.
No, please.
I was going to say, relating to that is, what are some of the solutions? And I think what we're sort of talking about with cars is the solution wasn't just to get people to drive safer. The solution wasn't just better roads and safer cars. It was all of those things.
Right.
The gun safety requires, the multiple levels and multiple points of intervention, and not every one size fits all. In some contexts, it might be one thing. In other contexts, might be another. But we need all of them, and that's what it took to reduce the number of deaths due to car crashes. Mm-hmm. That's what's going to take here too, I think.
Yeah, and that addresses one of the questions that came up here, which, really, why shouldn't this just be an individual solution? Why shouldn't we just teach you, the individual, to be safer with your individual gun? And it made me think about injury prevention theory, which I know you've studied a lot. And could maybe either one of you comment on sort of the idea of the Hayden matrix and how we think about different levels of intervention?
You teach the class.
Thanks. Just tell the world that. So the Hayden matrix, the basic idea is that you are focusing beyond just the agent or those that the individual or the person who might be injured. You also have the mechanism for injury. You have the context in which the injury occurs, and then you have maybe the broader socio-cultural context in which the entire event happened. And then what's interesting, they also the model will break down between pre-event, the actual event, and the post-event. And you can see how the different pieces of this matrix, as you start to piece them together, either help to facilitate the event happening, to cause the event to be more serious than it otherwise might have been. A typical example is driving your car on an icy road. So the agent is the individual. You can think, is the individual sleepy? Is the individual tired? Or same thing. Has the individual had alcohol? You can think about the mechanism, which is the car or the tree in which it's going to that might engage if you go around an icy road in a turn. You can think about the broader contextual features. Are we driving a new car that has safety mechanisms, or are we driving a car from 1994? All of those pieces play together and can have an influence on the actual outcome. And you can absolutely apply that to firearm violence as well. Thinking about not just the mechanism of injury, which we've already spoken to, but the individual who's engaging with the mechanism, as well as all the things that are surrounding the situations, all the things that preceded the situation, the actual event, how people are responding to the crisis afterwards, and then even the broader socio-political influence as well.
Yeah, that's right. And so that's why it's important that the individual certainly has agency to be able to make a lot of changes. For example, I can choose to drive my car slower and not drive it while I'm drunk, but I also will be a lot safer if I drive on roads that were built a certain way by engineers who were thinking about this, and also with the right airbags and seatbelts and other things put in place, as well as in a society that's put some basic guardrails around who is safe to drive and who is not. And that's why we can't just focus this, an injury prevention solution, simply on the individual. We need to think about all of the context across.
And when we focus on the individual, it's more than just knowledge. It's not, I mean, many of us know what it takes to make it to make us safer, but what we need to do is have strategies and other sort of supports to actually evoke that knowledge into action. And so even our intervention at the individual level need to go beyond simply just saying this is what you need to do. We need to help people practice what those things are, learn about the different strategies and what they could be, and then doing them and practicing doing them. And so there are some, we do know that there are some programs that are just basically a checklist about what it is to be safe. But we need more than just that, even if we just focus on the individual.
And that brings me to one of the questions that came up is about school curriculum. And the suggestion comes up that perhaps if we focused better, or one opportunity would be for us to focus better on nationwide school curriculums, especially for younger children or teenagers, around how to be safe around guns. And you want to talk a little bit about some of that?
Yeah,
research?
well, I mean, certainly the educational psychologist in me says it's always a good idea to have more curriculum. But at the same time, you know, there are programs out there that are designed to help young children to recognize and then ideally not approach and essentially avoid guns when they see them. And what's interesting is when we start to look deeply at how the curriculums are affecting these children, yeah, they might be able to reproduce that behavior in a controlled setting, but when taken out of that controlled setting, some of that impulse control is not there. So it's not as though they're not learning the information, but they might not be in, just ready developmentally, cognitively, to make some of those choices on their own. And therefore, education, again, is wonderful. I'm absolutely in favor of more education around gun and firearm safety, but I don't think that can be the end of it.
Yeah, and the research actually on this so far has shown that the educational programs, especially for young children, increases their knowledge, so they can give you the voice you back, daddy, the right words about, I know I'm not supposed to touch this, but when they can't actually resist the impulse. Mm-hmm. And that's because their brains just really aren't mature enough. If we think of our toddlers, school-age children, and certainly my teenagers still do not have the impulse control to necessarily do the right thing. A colleague of mine said recently that when he was a small child, a 4-year-old, he managed to get access to a gun that had been left in the car, and he can remember thinking really clearly, I shouldn't touch this, I know it's a real gun, but the overwhelming urge to want to play with this really shiny, exciting object was too much, and he picked it up and shot it. Unfortunately, didn't hurt anyone. But that kind of impulse control is what is lacking in children, and why the educational interventions alone simply won't work. We do have some web resources that are available. Let's back up a little bit. So we've talked some of the things about what we do know today. Why don't we have more research on this, and how should we have, what do we need to have more research on this so that we have more answers? How do we increase our funding for this research?
For me, I think it is taking a truly public health approach in that we're engaging stakeholders at every level of the continuum. It can't just be researchers sitting at the University of Michigan thinking about the ways that we're going to solve this problem. It's talking to gun owners. It's talking to politicians. It's talking to doctors and people who are seeing this problem every day. I think that's where the most innovative solutions are going to arise, and that truly is the way that within the School of Public Health and within the School of Medicine, we want to try to work with our constituencies so that it's community-based research that can find that happy medium that everyone's will be happy. That happy medium where everyone can have input and then ultimately improve safety.
Mm-hmm. Yeah, and for me, it's really about taking the politics out of this. If we didn't think about what the politics of guns were, and we just thought about the 3,500 children that died last year, all of us would want to do something to help those 3,500 children not die. And so how can we think about that using these frameworks that we have? And then, yes, it has to do with the gun and what can we do to be more safe around it, but really taking some of the politics out of the conversation, because this doesn't have to be political. It really, as you said, is a public health problem, and we have a crisis where we have an awful lot of children and adults dying, and we have good injury prevention solutions that can address that. And when we think about it with that frame of research, respecting the rights of our country and respecting our Second Amendment, we can probably move pretty far down the road. I think one of the other questions that often comes up and came up in here today is, what is the one thing, is there one thing we really need to do to fix this issue? And I like to think about this as we would never ask what the one thing is that would fix cancer. What's the one thing that would fix drowning, or the one thing that would fix car crash? This is an entire field we need to build of research for homicide gun violence and suicide gun violence and mass shooting gun violence. It's like many kinds of cancer, and for many kinds of cancer you need many kinds of research. And for many kinds of research we need substantial funding to build the entire field back up, so that we have hundreds of scientists working on this across the country. And we have some resources here for faculty across the country, or emerging students who want to be more interested in this. Do you want to talk a little bit about the data that's available?
Well, we helped organize the Firearm Safety Among Children and Teens, or FACTS consortium, that involves several universities, faculty from criminology, public health, medicine, sociology, psychology, to try to initiate or kick off or move the field forward and start to grow it as a field of injury prevention in particular. We have a website, childfirearmsafety.org. There's a database, a repository of data. There are resources for people interested in this topic. You learn about some of the pilot studies that we're trying to work on, and I think that's a start. We obviously need to do more, and there are other centers around the country that are beginning to focus on this, and we need to do that.
Yeah, we have on that site, I think you mentioned, we have almost 100 data sets that are available for secondary analysis that are freely downloadable by any student, faculty, anyone interested looking at digging into the data and starting to examine and find solutions and facts that could help move the field forward. The question came up around insurance, and for car insurance or home safety insurance for smoke alarms, the insurance agencies have gotten involved in other types of safety. Has there been any work or thinking about having insurance agencies get involved and help Americans be safer as they are for driving or thinking like that?
You have the better answer to this. I haven't heard of them, but you just mentioned the idea that just like we have, you get a discount for not smoking, you get a discount on your health insurance, that maybe the insurance companies could give a discount if you show you have safe storage for your firearms. Mm-hmm. And there's probably, we talked about the Hayden matrix and the ecological influences and multiple influences, that certainly there's a role for the insurance companies to play in that. And did you have some other?
Yeah, I think so. The insurance companies are involved in safety in many other aspects of American life, for sure. Currently, the insurance agencies we've talked to have been somewhat concerned about asking their clients on whether or not they had a gun, because they thought that might be a stigmatizing question, or they didn't want to bother them with it. But a lot of people would be interested perhaps in a break in their insurance if they can demonstrate they're responsible gun owners and store their guns safely. I think it's maybe not the only answer, but perhaps one of the suite of answers that could be considered as we try to address this problem, is thinking about what is the role of the insurance agencies in our country.
And when we've seen similar stigma overcome, for example, with the distribution of naloxone, and people being afraid to ask for naloxone as the opioid crisis was underway. And as the standing orders have become more common, people have been accessing the treatments that they need. And I think it would be a similar situation here, where if we can get past that stigma, you might have more people voicing just either support or at least curiosity about this, and might ultimately get more momentum behind the idea.
Right, and there are so many responsible gun owners out there that they may be more than willing to demonstrate this and perhaps even
save some money.
And save some money. So thank you, Dr. Zimmerman and Dr. Heinze, for this conversation today, and we really look forward to more of your questions and participation. Thank you.